In fact, it's the first time we are talking about kinesiology, I guess. So I'm very happy because it's very special and unknown. Kinesiology was born, maybe I can. Yes, kinesiology was born in the US in the 60s with Dr. George Goodhart, a chiropractor. He developed a new medical approach called applied kinesiology. He was joined by Dr. John Thie, and John Thie developed the Touch for Health method for non-medical people. Some medical doctors and PhDs were passionate about this new approach. So, depending on their own interests, they developed several other non-medical branches such as edukinesiology, 3-in-1 concept, wellness kinesiology, brain gym, etc. I practice non-medical kinesiology. Each time I say kinesiology, I mean non-medical kinesiology. Please keep that in mind. So that means without any diagnosis, no treatment, no prescriptions. Kinesiology postulates that our emotions and thoughts have a direct impact on our body. The non-medical kinesiology is an educational model. It provides tools and methods for managing and achieve a greater well-being, for managing stress, of course. I forgot one word. Sorry. Kinesiology is concerned with all forms of circulation and movement on our body, with the aim of maintaining fluidity and balance. The harmony is like a triad of health, in which the sides are mental wellness, or emotional wellness, chemical or physiological wellness, and structural wellness. They are kept in balance by the circulation of energy. I practice kinesiology on 3 main levels. The first one is the emotional one. Kinesiology helps to identify repressed or blocked emotions, giving a space for free expression of strong emotions such as anger or fear. Second point is physical level. Physical level. Specific movement help to anchor the mind in the present and create a calmed sensation. By observing the tension in our body, we can recognize the physical manifestation of emotional and mental states and disassociate them from the manifestation of illness. It helps to free the body of the discomfort and pain directly associated with the stress. The third level is the mental one. The third level is the mental one, yes. The kinesiology teaches us to step back and observe our thought without judgment, no attachment. This creates a space of choice between thought and action, giving us the freedom to choose how to adapt in the life of constraint. For all that, I use muscle testing. It's about muscular tonus or muscular energy. It's not at all about strength. It's helped me to identify energy imbalances in the body. This opened the door to target and personalized session. Kinesiology is therefore as much for patients as for caregivers and for any other member of the family. For example, I can present you Anne-Lise. She is 35 years old. She takes care of her mother. She's exhausted and doesn't dare say it. In my office, she has found a space to express her fears, her feelings of injustice, and put her guilt at bay. She has learned to accept all the types of her thoughts with kindness. She has become more understanding of the others. The mental flexibility makes it easier for her to adapt to the unavoidable changes and challenges in her life. She is now able to maintain activities that give her joy and satisfaction. Let me introduce you Adria. She has a systemic lupus with severe organ damage. She came to see me to find out. She didn't know what to expect. I was born hungry, she told me the first time I saw her. The kinesiology techniques enabled her to express her hunger, to release it, and to find peace. Her concern is to be able to organize her funeral. She wanted to make the most of her family and to prepare the aftermath for her daughter. Despite her dependence, she found spaces of freedom when she could express her choices. The sessions enabled her to make more informed decisions. She found forgiveness and appeasement, and I was able to release some tension in her body. Her last words in my office were, "I feel really good, I'm serene and at peace." Let's talk about my father. In reality, not my father, but my mother, because my father died of ATTR amyloidosis in 2015, and I inherited of it. This has left my mother with a lot of anger and grief. These emotions are imprinted on her body and crystallize into a multitude of pain. Kinesiology sessions help her to understand the mechanism. But in 2022, Mom had a cardiac and respiratory arrest. When she came out of her coma, she was lost and had a lot to relearn. The kinesiology techniques enabled her to make spectacular progress in both intensive care and rehabilitation, so much so that the doctors and nurses asked me what we had done and how other patients could benefit from it. So, based on my experience, I'm delighted to be able to present you kinesiology today as a great support for the patient therapy and the commitment of caregivers. As a conclusion, please maybe consider that non-medical kinesiology may provide an effective support working hand in hand with doctors. Many thanks for your attention.